Welcome back to Digital Physio. Today we'll be talking about patellar tendonitis, or more commonly referred to as patellar tendinopathy by healthcare professionals. We'll be deep diving into numerous topics surrounding patellar tendonitis, and you can view these in the timestamps listed here or in the description below. So let's get into the topic today. So what is patellar tendonitis? When we look at the term tendonitis, it refers to inflammation of the tendon. With more research emerging, healthcare professionals are more inclined to refer to tendonitis as tendinopathy. The reason why tendinopathy is more commonly used than tendonitis with healthcare professionals is that inflammation is now seen as less of a driver for overuse tendon conditions. Patellar tendinopathy, which is sometimes known as jumper's knee, is an overuse condition that affects the patellar tendon, the tendon that connects the patella, or the floating bone of the knee, to the tibia, also known as the shin bone. There are many roles of this patellar tendon. The first being the bridge that helps connect the muscle to the bone that allows movement through the knee. The second is to absorb shock and impact for the lower limbs. It's important to understand that in the normal function of a tendon, it undergoes a continuous cycle of breakdown as well as recovery and restoration. When the tendon experiences an accumulated strain and stress that's past its ability to recover, it can lead to wear and tear, along with changes in the tendon that includes degradation of collagen fibers, as well as the intrusion of neurovascular structures within the tendon. When talking about accumulated stress and strain, the activities that impact tendon the most are explosive activities such as jumping, running, and changing directions. Whilst still possible, patellar tendinopathy is less likely to be caused by trauma, direct impact, or a sudden strain like you would with a muscular injury. These changes can lead to symptoms such as knee pain, as well as impaired ability to move and exercise. Over time, this can lead to degenerative changes of the tendon and chronic injury to the tendon, which can best be described as a cross-sectional area comparable to a donut, where we have a healthy tendon on the outside and an unhealthy tendon on the inside. And left long enough, this can lead to permanent damage within the tendon. The objective of rehabilitation would therefore be to try to increase the strength of the remaining healthy tendon. So how do you know if you've got patellar tendinopathy? Well, there are a few ways that can help diagnose the condition. The best bet would be to seek support from your local healthcare professional, such as a physiotherapist or a doctor. But there are some signs that might indicate that you might have this condition. First is identifying aggravating activities that load the knee. These activities include squatting, lunging, going up the stairs, or any activity that really loads the quad. Typically, most people with patellar tendinopathy have no symptoms or little symptoms during rest. Next is identifying the location of the pain. While not always the case, most incidences of patellar tendinopathy is located in the infrapatellar region, or the area located beneath the knee, and is often in a very specific region that you can pinpoint with your finger. One physical test that healthcare professionals use to diagnose patellar tendinopathy is a single leg squat on a 25-degree decline board. If you don't have a 25-degree decline board, you can use anything that can help elevate the heel instead. The objective of this test is to identify whether or not you have pain located in the infrapatellar region of the knee. A positive test may indicate that you have patellar tendinopathy. Imaging using MRI and ultrasound can be useful in diagnosis. However, it's important to understand that changes identified on the tendon through this imaging doesn't necessarily mean you have patellar tendinopathy, especially if you don't have any symptoms associated with the condition. In a cross-sectional study by Little and his team in 2020, they had conducted an ultrasound and MRI imaging of 250 adult knees between the ages of 25 and 60 without knee pain. Despite not experiencing any knee pain, 37.3% of these individuals had imaging which demonstrated abnormal changes on the patellar tendon. While imaging can be informative, it should not be the only piece of information considered when making a diagnosis, especially in the absence of positive clinical signs such as infrapatellar knee pain and limited movement. One of the most important ways for helping you manage patellar tendinopathy is graded rehabilitation and exercise. While the structural changes associated with patellar tendinopathy may not always heal, you can still resolve your knee pain and return back to your chosen activity or sport. Now, there are several things that you can do to kickstart your process of recovery and getting back into doing things that you love. Number one is setting expectations and being realistic about how long it will take to get better. Overused tendon injuries need time to rehabilitate and get better. Based on my experience as a physiotherapist and working with patients who've had this issue before, it can take up to 6 to 12 months in order to fully recover or getting back into doing the things that you want to do. Based on my physiotherapy experience working with patients who've had this injury, it can take up to 6 to 12 months for a full recovery in order for you to get back to doing the things that you want to do and being active again. The second crucial element to help you recover from patellar tendinopathy is load management. Making sure that exercise or activities that overload the patellar tendon is modified and or reduced. Without sufficient rest, you'll continue to aggravate and cause more injury to your patellar tendon. And thirdly, and in my opinion, the most important step, particularly if you're someone with high ambitions or really want to get back to being physically active, is rehabilitation. Exercise rehabilitation is a crucial way to help you actively recover from your injury. According to a clinical commentary article by Peter Malliarius in 2015, there are 4 distinct phases for patellar tendinopathy rehabilitation with distinct objectives, goals, as well as progression milestones. Stage number 1 is isometric exercise, which help minimize the pain on a day-to-day basis. Phase number 2 are isotonic exercises that help strengthen up the muscles around the knee, particularly the quadriceps, and to some extent the tendon as well. Phase number 3 are energy storage exercises such as plyometrics, which helps the tendon improve its capacity to store and unload energy. And phase number 4, working on exercises and finding programs that helps you return back into the activities and sports that you want to pursue again. So the next part of this video, we'll go through step by step the specific details and the types of exercises in each rehabilitation phase for patellar tendinopathy. So stage 1 is isometric exercises, and the main objective of isometric exercise is to decrease your pain and act as the starting point of your rehabilitation journey. It only takes 1 set of heavy isometric exercise to decrease your knee pain by up to 45 minutes after completion of your set. An isometric exercise is a movement which is held in one position for any given time without moving through a range of motion. Researcher Ebony Rio and her team speculates that an isometric exercise can positively affect how the brain communicates with the musculoskeletal system in a more effective manner. Examples of common isometric exercises include a Spanish squat, an isometric squat, and a leg extension held between the ranges of 30 and 60 degrees. Personally, if you have access to a leg extension machine, I actually prefer this, as you can gradually add weight for further progressions down the road. Stage 2 of your rehab is isotonic exercises. Isotonic exercises involve activities that move through a range of motion consisting of concentric and eccentric muscular contractions. Isotonic exercise is extremely important for improving muscle bulk and size, and in the case of patellar tendinopathy, the quadriceps is particularly important. As an easier starting point, you may consider working within 0 to 60 degrees of knee flexion to prevent irritation that might occur from a deep stretch of the quadriceps and the tendon. Once comfortable, you can progressively work towards 90 degrees as your pain permits. While you can start off with double-legged exercises, it's important to also perform single-leg variants in order to avoid muscular imbalance. Common isotonic exercises include a seated knee extension and body weight squats. If these exercises are aggravating the knee, please consider reducing your range of motion and working partial knee extensions and squats instead. Progressing your exercises gradually will be important to strengthen up the tendon. That's why you might consider single leg variants like a split squat and step up as well. Further down the road, you can even add more weight using dumbbells and barbells. Performing exercises such as weighted squats, weighted split squats, and weighted step ups as well. Heavier loads may help the tendon to adapt and strengthen. However, too heavy of a load may actually aggravate the tendon. So stage 3 is your energy storage exercises, and these can be commenced once you've perfected and mastered your isotonic exercises. Some studies have suggested that you may commence stage 3 once you can do a single leg press 1.5 times your weight for 4 sets of 8 reps. However, for some people, this may not be realistic from an equipment or feasibility point of view. However, for me personally, I recommend that you can start this phase once you can do a single leg squat on a decline board for 3 sets of 15 repetitions with less than 3 out of 10 pain once completed. Energy storage exercises focus on tendon adaptation. When you look at the tendon, it's quite similar to a spring. During a moment of impact, while you're running or jumping, the tendon will store energy once you land, and once you head off the ground, the tendon will release the stored energy. This is comparable to a spring when it uncoils once you compress it. That's why energy storage exercises that target power and force, like plyometrics, are so important for specific tendon adaptation. Depending on your fitness levels and goals, examples of plyometric exercise can include jumping up and down a step, which can then be progressed to a high platform like a box. You can progress with single leg exercises like alternating lunge jumps, hopping forward, hopping on the spot, or even hopping down a step. However, it's important to note that this stage can also be very provocative on the tendon. It's important to monitor pain and rest when appropriate. For most people, I wouldn't perform more than one session of energy storage exercises for more than 2 to 3 days within a week. Stage 4 of your rehab journey. This is the stage where you begin to start on specific exercises related to sport or activity. In this stage, the focus will be performing functional exercises relevant to your chosen sport or activity. For instance, lateral hopping might be less relevant for a 100-meter sprinter when you compare it to a tennis player. You may need to call upon your own expertise and experience to determine what movements you'll need to focus on in your specific sport or activity. So to summarize, number 1, patellar tendinopathy is a response to activities that load the quadriceps, particularly explosive movements like running and jumping. When the accumulated load exceeds the capacity for your tendon to recover, your condition will worsen. Activity reduction or modification is particularly important in the early stages as you're beginning to recover and starting your rehab journey. Personally, with the patients that I've worked with, I've never seen someone recover from patellar tendinopathy without incorporating these steps initially. Exercises that can help patellar tendinopathy can be performed in a staged manner across 4 distinct phases. Phase 1, isometric exercise to help relieve pain at baseline. Phase 2, performing isotonic exercises which help strengthen and increase muscle bulk to help with your tendon's capacity to perform certain movements. Stage 3 refers to energy storage exercise to help with power and the elastic properties of the tendon. And phase 4, functional exercises that will be relevant for you to return back to your chosen sport or activity. Thank you for watching this video. If you have any questions or comments, please don't hesitate to let me know in the comment section below. In the meantime, I would greatly appreciate if you could leave a like on this video and subscribe to this channel as well. I hope to be able to continue making ongoing free videos about all things musculoskeletal health. In the meantime, I urge you to move well, to stay well.